guys, welcome to my channel Apariyanursingeducation. Today I will discuss about GCS, Glasgow Comma Scale and mnemonic. Let's start. First of all, discuss introduction. The Glasgow Comma Scale was first published in 1974 at the University of Glasgow by neurosurgery professor Graham Tesdell and Baron Jennett. Then the Glasgow Comma Scale is used to objectively describe the extent of impaired consciousness in all type of acute medical and trauma patients. Then discuss definition of Glasgow Comma Scale. The Glasgow Comma Scale is a clinical scale used to reliably measure a person's level of consciousness after a brain injury. Then the Glasgow Comma Scale is a quick, practical and standardized system for assessing the degree of impaired consciousness. Then discuss objective of Glasgow Comma Scale. To explain the value of the Glasgow Comma Scale for patient care, then use stimuli to test the patient for their best response in the three areas. Stimuli can include a verbal, painful and pressure stimulus. Then to summarize the severity finds for each range of the Glasgow Comma Scale. Then discuss indication for use. First, hypoxia means lack of oxygen in tissue. Then post neurosurgery or vascular surgery to carotid vertebral artery. Then prolonged epileptic seizure. Then fall and trauma to head. Then metabolic imbalance such as hypoglycemia means blood glucose level is too low. Then drug overdose. Then neuro impairment means nervous system damage includes the brain and spinal cord. Then unresponsiveness. Then discuss scale scoring. Glasgow Comma Scale check three components. EVM. E stands for eye response. V stands for verbal response. M stands for motor response. Eye response 1 to 4. Verbal response 1 to 5. Motor response 1 to 6. Then discuss score. Glasgow Comma Scale total score 15. Then discuss Glasgow Comma Scale score of trick. AVPU. A stands for alert. The score 15. V stands for respond to verbal stimulus. Score 13. P stands for respond to pain stimulus. Score 0.5. Then U stands for unresponsive. The score 0.3. Then the minimum score is 3, which indicates deep coma or brain dead state. Then the maximum score is 15, which indicates a fully awake patient. Then discuss level of neurological injury. Mild greater than 13, moderate 9 to 12, severe less than 8, death less than 3. Then discuss the Glasgow Comma Scale components in the story of mnemonic. To remember this component, EVM. First, E stands for eye response 1 to 4. Let's imagine World Cup. watching the cricket match on the ESPN sports channel. ESPN. E stands for eye opening spontaneously. 4 means if patient's eyes are open upon approaching the bed or remain open when not spoken to. Then S stands for to sound. 3 means verbal stimulus. If patient's eyes open when spoken to or shouted at. Then P stands for to pain. 2 means painful stimuli. Apply pressure to the patient's fingertip. Squeeze the patient's trapezius muscle. Then apply pressure to the patient's supraorbital notch and pinch the patient's nail bed. Then N stands for no response. 1 means no eye opening, means no response to speech or pain. Then discuss V stands for verbal response. 1 to 5. इंडिया अगर मैच जीत जाता है, कैप्टन बोलते हैं आवर कंट्री विन. देन O stands for oriented. 5 means patient responds coherently and appropriately to questions such as the patient's name, age, where they are and why, the year, month, etc. Then C stands for confused. 4 means the patient responds to questions coherently but there is some disorientation and confused. Then W stands for words inappropriate. 3 means patient response to questions are inappropriate or irrelevant to question. Then I stands for incomprehensible sound. 2 means moaning but no words. Then N stands for no response. 1 means no verbal response. Then M stands for motor response. 1 to 6. After the match complete, captain said that cannot live without fan. Then C stands for obeys commands. 6 means patients obey simple commands. Ensure patient's hand squeeze is not grasp reflex by asking them to release their grip also. Then L stands for localizing to pain. 5 means purposeful movements towards painful stimuli. Example, brings hand up beyond chin when supraorbital pressure applied. Then W stands for withdrawal for pain. 4 means absence of abnormal posturing, unable to lift hand past chin with supraorbital pain but does not pull away when nail bed is pinched. Then F stands for flexion to pain abnormal. 3 means decorticate, means flexor response, internal rotation of shoulder, flexion of forearm and wrist with clenched fist leg, extension, plantar, flexion of foot. Then A stands for abnormal extension. 2 means distribute, means extensor response, adduction of arm, internal rotation of shoulder, prominence of forearm and extension at elbow, flexion of wrist, and fingers, leg extension, plantar flexion of foot. Then N stands for no response. 1 means no motor response. So this was 3 components and trick of GLASGOW COMA scales. Then discuss factor effective with GLASGOW COMA scale assessment. First discuss pre-existing factor. Basically language barriers, intellectual and neurological defect, hearing loss and speech impediment. Then effect of current treatment. Basically physical, pharmacological, example sedation. Then effect of other injuries, basically cranial fracture, spinal cord damage. Then discuss limitation of GLASGOW COMA scale. First, tracheal intubation and severe eye swelling or damage make it impossible to test the verbal and eye response. Then injury to bone, then excess sedation, hearing problem, mental deficiency. Then the GLASGOW COMA scale has limited applicability to children, especially below the age of 36 months, where the verbal performance of even a healthy child would be expected to be poor. So this was the GLASGOW COMA scale. I suggest you आप लोग मेरा वीडियो फर्स्ट से लास्ट तक देखिए. I hope you understood this video. Any doubt, please comment me on comment box. Then I will clear all doubt. आप चाहे तो मेरा टेलीग्राम चैनल ज्वाइन कर सकते हैं. लिंक आपको डिस्क्रिप्शन पे मिल जाएगा. If you understood this video, then please like, share and subscribe my channel. Thank you for watching.